Okay, so the anatomy of the temple we've talked about. We're going to do the landmark. So this is our zygoma. Our zygoma runs from here to here. So this is our superior border of the zygoma. That marks our most inferior landmark for the temple. Then we've got the orbital thickening. So we're going to run around here, around the eyebrow. And then we're going to go to the temple crest, which is this fusion line here, the temporal fusion line. So you can ask your patient to kind of grit their teeth, and then you can mark it out yourself, the junction between your frontalis and your temporalis muscle. So that typically sits there. And then your hairline marks as your most posterior boundary. And most of our filler will be placed in this portion here, where you can see some of the concavity. So your frontalis has what we call in aesthetics, you have your projection of tissues, which is your hill, and then you have a depression, which is your valley, and then you have a projection again, and that's your hill. So this little dip here is the valley, and this area here is where we'd like to place our filler and restore some of the volume from the forehead to the zygoma without the depression. Okay, so our zygoma runs here. That's the most inferior border of our temple. And then the lateral orbital thickening, that comes across up around the eyebrow, and then you've got our temple crest or temporal fusion line, which just runs along here. You can feel it, but it's the junction between your temporalis muscle and your frontalis, and that typically runs there. And then your most posterior border is just the hairline, so we'll be coming across here. So in aesthetic medicine, we always look at light and shadows, and this is often characterized by a projection of tissue. So that's the hill here, that's a nice projection from the frontalis. And then we have a valley, and that's a little depression here in the temple, followed by a projection again around the zygoma and the cheek, and there's your hill. So the kind of transition from your hills to your valleys casts lights and shadows. So our filler is predominantly going to be placed in this section here, where we see this slight depression, so we can project the tissues out and bring it back into the light. So our vasculature to be in this area is often mostly the superficial temporal artery, which is around about 1.7 millimeters anterior to the tragus, and then it runs up. After about 3 centimeters, it bifurcates and goes off anteriorly and also posteriorly. And this branch here, typically anastomosis with the supraorbital artery around here. So these are the important aspects that we need to consider. And remember, our superficial temporal artery runs in layer 3, which is the superficial temporal fascia. So we're going to be sitting in layer 2, just above it, away from the traffic, and filling linear threads in this section with KYSENSE precise, in this case, or KYSENSE define in other cases. So the pre-bending, just going to take the cannula and just bend it at the neck of the cannula ever so gently. We have a slight pre-bend there. So we're going to put the entry needle in very superficially because we don't want to go too deep. Little scratch, and there we are. And then we come back out. No major blood bleeding from there, so we know we're in a nice area. If you do encounter any large bleeds, just stem the blood, and once it stops bleeding, choose a different area. Sometimes you need to give it a little squeeze because our patient has great skin, so sometimes when we puncture the area, we can't quite see where we're going to go. Now we're going to use a smaller or a shorter cannula in this case because our patient is quite petite. So we don't necessarily need a 50 millimeter cannula. So this is still a 25 gauge cannula, but it's 38 millimeters. So as you can see, I can see the shape of my cannula there. And I'm just gently threading that through, up through the temple. You may catch any little snags, any little fibers. If you find that you encounter too much resistance, you can just control your tissue by just gripping the skin and then control the tissue and then advance further. And now you're into the right plane. So we're in layer 2 the whole time, just advancing all the way up. And we're going to be injecting this area with linear threads. So little injections coming now, just let me know if it's too uncomfortable. You'll just see the filler coming through along this plane here. And then you can just redirect. Always keeping superficial each time. You okay? Yeah. Same again. Nice linear threads. Now a little trick you can do is you can go under the eyebrow. So if you want to, if you have a patient that has lower set eyebrows, you can just dip in underneath. Just control your cannula once more. It can get a little bit uncomfortable around this area. It's alright, you okay? Just lift your eyebrow up there and just give a little bit of filler just to support the tail of the brow. There you go, so we've filled all the way to here, a little bit higher. Now we can just give a gentle massage at the end. Just pop this down, see that in action, just to smooth out any lumps and bumps. This will integrate gently into your tissues over the next 2 to 4 weeks, so don't worry about any little irregularities that you encounter at this stage. Everyone's different and sometimes the area can appear more vascular. So if you find that, it will all settle down. Just needs a little bit of time. So we've used very small volumes there. We've used approximately 0.3 to 0.4 mils of the KYSENSE Precise. So you can see it goes quite a long way. So we've used 0.4 mils of KYSENSE Precise. If we just go back to our analogy of hills and valleys, we've got projection of tissue here, that's our hill. And then here we had a little valley, the concavity, and that's now being filled in with the KYSENSE Precise. And there's a lovely transition from this area, the hollowing of the temple, now into the zygoma and around the eye. So we have a nice 1-to-1 ratio all the way around. If you just turn your head towards the camera, you can see on the untreated side, the frontalis has a hill, then it still has this depression here, this little concavity, which this temple needs to be filled. And then we've got this little hill projection tissue here from the zygoma. So the darkness here, or the shadowing here, is created by this dip. And that's been resolved on the right side with the filler of 0.4 mils in total. Just grit your teeth again and relax.
When you say grit your teeth, do you mean the back ones, yeah?
Yeah, that's fine. You ready? So just looking at our landmarks again, so we've got our zygoma, so we use that as our inferior border, lateral orbital thickening up to the temporal crest, and then our hairline for our posterior border. So we have our anatomy of our temple there, when we're making our entry just inferiorly here, and we put linear threads across this section because this is fairly full, but this is mostly where our depression is. So same thing again. You ready? Ready? Little scratch coming in. Well done. I'm just going to pop the cannula through. Nice and superficial. You can see the body of the cannula, and the pre-bend really does allow you to keep superficial. Your cannula will always want to go deep, so that pre-bend keeps you superficial irrespective of whether your cannula wants to go deeper or not. So if I just raise my cannula, you can see the body of the cannula, and that's layer 2. If you can see the body of your cannula, then you know you're in the right layer. Nice slow linear threads coming in. Again, if you find any little snags, just grab the tissues so you can control them and advance your cannula further up. You okay?
Yeah.
Just working our way backwards more to the posterior border of the hairline. If you remember at the beginning, our superficial temple artery runs up here, coming across and joins hands with the supraorbital artery. So this is really your highest risk area. So if you wanted to do some targeted digital pressure and inject, that keeps you even more safe. But providing you stay in layer 2, the subcutaneous fat, those risks should be fairly well mitigated. I'm just going to go back under the tail of that brow, so you might feel a little snag just here. There we go, so we're just under the tail of the brow. Lift the brow up, and you can put a little bit of filler just underneath, just to give that little bit of extra support. So you can see the irregularity of where the filler's been, so some gentle massaging will help. And you can just draw the filler up the way towards your temporal crest. And the filler won't migrate into the forehead because you've got this suture line here. And there we go. So nicely filled. We have the projection of the tissue. We had a little depression here that's now been filled, and then back to the projection of the zygoma. So we have a nice C shape, and it's all one-to-one and confluent.